Hello, welcome to We Care Talks. I am your host, Udit, and I'm joined with our expert and main speaker, Dr. Sant. For those of you who have maybe not met him before, Dr. Sant, could you give us a brief introduction about yourself?
Sure. Basically, I was a cardiac surgeon doing heart operation for 20-something years, partly in New Zealand and partly in Thailand. At one stage, when I was 55, I've got acute coronary heart disease myself. So since then, I changed. I decided to use lifestyle modification to treat myself and found out that, wow, it's great. The result was extremely good. So I decided to quit cardiac surgery, retrain myself to be a lifestyle doctor. And nowadays we call it lifestyle medicine practice. I've been doing this for 15 years.
Yeah, so I think everyone here, like I am 33 years old myself, and most of us would like to find a way to keep ourselves healthy without the use of medicine. And I think that will be a goal for a lot of our audience here today. So we hope you can help us and give us some advice.
Oh yes, sure. I have been with chronic disease patients trying to reduce or discontinue their medications for 15 years. So on the way, I learned quite a bit.
Yeah. So from what we found is one of the most popular topics today. I think the topic of choice that we're going to be discussing is going to be protein. So I'm sure you've had a lot of conversations about this before already. As some people would say, the most important macronutrient.
Yeah, I understand that. What we call protein mania. Actually, it was peak just post World War II. But since then, the protein standard protein requirement set by the USDA just coming down. In the age of protein mania, they set standard requirement something like 110 grams per day, which about twice nowadays. But still, every day people still too much concerned about protein. I think one main concern is the misunderstanding about the quality of protein from plants versus from animal. The myth is that protein from plant is not completed. Because when we talk about protein, we focus on what we call essential amino acids, which our body cannot build.
Right. So essential amino acids are what the body cannot produce.
Right.
And non-essential is what our body can produce.
20 amino acid, 9 essential. And the belief is that most plants do not have complete all 9 essential amino acids, which is not true. In 2019, there was one very good research published in Nutrition Review journal. Analyzed the protein content of nearly all major food in U.S. market, plants and animals, and analyzed down to each of every amino acid, 20 amino acids, and found out that all plants have all essential amino acid in itself. Actually, all plants have all 20 amino acids in itself. So that is not true. That the belief that plant protein is not complete is not true. That is one major misconception or one major myth. This myth push people toward animal source of protein.
Animal-based source of
Right.
protein because plant-based sources are incomplete and do
Incomplete.
not contain all essential amino acids you need to survive.
And even in the medical community, doctors, they still believe that plant, there is not complete amino acid in lots of plants, except for doctors, except only soybean, something like that.
Yeah, I just did a new personal trainer course 2 years ago, and one of the multiple choice questions on the exam is which of the following 4 is not a complete protein? And the answer is whichever one was not an animal source. So I think
And the exam
this is an exam
the
question.
exam like that still in medical school,
Yeah, it's still an exam question. It exists. So that was the answer. That's why I think, this is one of the main myths about protein. Maybe if you want to, maybe we start right at the beginning. Maybe you can explain to people what is the chemical structure of a protein and an amino acid for those who are interested and why it's such a big topic in nutrition.
Well, when we talk about food, we categorize them into macronutrient.
Yes,
And
3 macronutrients.
Micronutrient. Macronutrient include carbohydrate, protein, and fat. Protein different from other 2 because it contains nitrogen. And the main function of protein in our body is to be used as the material for the cells to produce all kind of molecules in the body. But when we digest all protein molecules, it will come down to its what we call basic building block called amino acid. Similar to when we demolish the house, be it Italian house, French style house, at the end you get the brick. The brick is basic building block of the house. So amino acid is the basic building block of protein. And of 20 type of amino acid found, 9 of them our body cannot create.
We must eat that
From the raw material. Yeah, we got to eat from food.
from food only.
So these 9 we call essential amino acid. And this leads to the concept of completeness or incompleteness of protein sources. But I would like to emphasize the research published in the nutrition reviews in 2019 that I mentioned. Very good analysis. All plants that we know, all animal contain all 20 amino acids. Some in large amount, some in small amount, but all contain all essential amino acid. That this is a very important point because people tend to turn toward animal source of protein because the concept of completeness or incompleteness.
So you were talking about protein quality.
Yeah.
So how, like the average person like me, how do I know what is a high quality protein, what is a not so high quality? How do you in the scientifically define these terms?
You use the word scientifically. Scientifically, we got to base on what we call epidemiologic data in real people. There is no protein deficiency in people who eat large variety of food.
Yeah.
Be it vegan, vegetarian, or what we call omnivore. So if they maintain a large variety of food, there will be no protein deficiency because our body has distinctive ability to choose to absorb the amino acid that the body wants. So there's no point. Pay attention to good source of complete protein, bad source of complete protein. Just keep on eating large variety of food.
Okay.
Even vegan can go without protein deficiency if they keep on eating large variety of food.
So basically, as long as you're eating a large variety of food which has
Right.
different types of amino acids present, and as long as you are eating enough calories,
Oh yeah,
Per day.
that is the another big point.
make sure you're eating enough calories.
Yeah, that is another big point because people nowadays they talk about protein because if they are young, they want to build.
Build muscle.
Yeah. If they are old, they want to prevent what we call sarcopenia, the weakening and diminish of muscle mass. The point is that calorie intake is the main point to maintain the muscle mass. If the calorie intake is not adequate, of course, the body will use the protein as the source of to burn down the
Yeah.
protein. Particularly, I see a lot of my patients who are marathon runner. They spend they lead very active lifestyle, use a lot of calorie, but calorie consumption is basically not enough. So they got thinner and thinner and thinner, and at the end of the day, they got what we call osteoporosis and fracture. Even they are
They
marathon
exercise
runner.
a lot and run.
That's because the inadequacy of calorie intake, and this is an important point for those who turn toward low calorie diet like a plant-based diet.
Exactly.
They've got to maintain enough calorie intake so that they can maintain their muscle mass.
So I think, yes, commonly same thing like amongst like personal trainers and things trying to like build muscle. I have heard some examples. They say they tried the vegan diet for a few months and then they felt that they were like lack of energy, that they were losing weight, they feel tired. So basically they said the diet doesn't work for them. But most likely, as you said, it's because they were not eating enough calories based on
Right.
their very active lifestyle. If they're a trainer, maybe they're exercising 2-3 hours a
Right.
day. And then because they are losing body weight and muscle mass, then they start to feel maybe the negative sides of things, especially as when you adopt a diet, which is a plant-based diet where it's low calorie density,
Yes.
you need to actually
You
eat.
know, people they don't realize that plant-based diet are very low in calorie. For
Yes.
instance, when we compare rice, which is the main source of calorie in Thai food, rice, and watermelon, sweet watermelon. Sweet watermelon has 5 times less calorie than rice. Yeah. So people don't realize that when they eat plant-based diet, they reduce a large chunk of calorie intake. They got to increase consumption of calorie to maintain their body mass.
Yeah, so you almost need to be eating double the volume of food that you used to eat, maybe on the opposite in terms of
probably
weight, the
3
weight,
times or 4 times.
or 3 to 4 times the net weight.
Not double.
Not double is still not enough. Okay, yeah. So if you are going to eat more plant-based, so
right.
okay. And another one that I always see a question that comes up is about the leucine content, the amino acid leucine, as this is like the main amino acid that's for muscle growth.
Actually, the factors that contribute to the muscle mass is not the type of amino acid. There's factor. The main factor is one thing is exercise, training, muscle training. Okay, the second one is the hormone, like androgen, testosterone, and third one is the age. Elderly people they tend to lose muscle mass. It's natural. So these 3 components are main things. Type of amino acid does have nothing much.
Okay.
And to maintain, there is a good study in young people comparing those who use the all essential amino acid in what we call whey,
Yep.
whey protein, 20 grams a day, and control group use placebo, fake whey protein, and compare the muscle mass. Both of them do the muscle training,
Do the same exercise program.
and the group that consume all essential amino acid in whey protein build better muscle mass comparing with the other group. So there is no data pinpoint to any particular one amino acid because we cannot handpick amino acid for our body. Our body will select to absorb the amino acid it exactly want.
Okay. So, because this is just one of the arguments we hear for, again, why animal proteins are better than plant proteins for like building muscle mass is the leucine content.
No. It is the fact that those who consume animal product will build bigger muscle because animal product it contains higher energy,
More calories.
more calorie. Because one study done in England, they study the chicken breast, peel off the skin,
Yeah.
chicken breast, and analyze the chicken breast. How many percentage of content of the fat? It's 50%. 50% of what we believe to be lean meat, 50%
Still comes from fat.
come from fat. So enough energy plus muscle training make the muscle
They look
big.
bigger.
For weekend bodybuilder, they got to eat a lot
Yes.
to achieve that amount of energy. And that I'm not an expert on the bodybuilding because I'm the doctor. I pay attention to mostly from health perspective.
Yeah, there's different, of course, I think it's different goals. One is about
right.
increasing your muscle mass versus actually like longevity of your health. So those are not comparable. And I think we also have to look at studies where they equate the calories for both sides, right? Sometimes if on the animal-based protein diet in the study and the plant-based protein diet, if the calories are equal, then you would assume that the amount of muscle growth is probably also going to be equal because the weight gain or loss should be about the same in both groups.
Concerning bodybuilding, one thing from the health perspective is that the too much protein.
Yeah, so the
To
next
help.
question was going to be, is there any negative consequences to having too much protein in your diet? Or so what does the body do with excess protein that we consume and it cannot use?
Usually the body will discard the excess protein through the kidneys.
We cannot store protein, right, in our body.
No. There a good study done by Harvard. They call it a Harvard meat consumption mortality, the death rate of the meat consumption protein, published in Archive of Internal Medicine. In this study, large amount of protein, more than body need, no problem. But the source of protein is the problem. If that large amount of protein come from plants, there's no effect on the mortality. What we call mortality is premature death rate defined by the death before age 70. That is medical term, premature death rate. If you eat a lot of protein beyond normal requirement, if those protein come from plant, there's no effect on the premature death rate. But if those protein come from animal, they will has big effect on the mortality, higher mortality. And when you swap source of protein, not much, only 3% of protein from animal-based to plant-based protein, you see the drop of the mortality. Yeah.
So what is it in the animal protein that is causing the inflammation or causing the increase in mortality rates?
This Harvard study is what we call the epidemiologic data. It cannot explain the mechanism.
Okay.
But the proposed mechanism is that there are 2-3 mechanisms. The one is that the animal protein is the source together with the bad bacteria in the gut.
Mm-hmm.
It will turn 2 type of molecules in animal protein, choline and arginine, into a chemical called TMA.
TMA.
And this TMA, when absorbed into the blood circulation, it will be processed by the liver and become what we call TMAO. Anyone who has high concentration of TMAO in the blood will destined to have the vascular disease, inflammation of the blood vessel, which is the starting point to heart disease, brain disease, or whatever, because every organ need a vascular supply. So the TMAO production is one mechanism, one proposed mechanism. The mechanism is real, but whether it's shorten the lifespan of those meat eater or not, by this mechanism, we don't know.
That's not for sure. And this doesn't occur when you eat plant-based sources of protein?
No,
This only
because
exists-
plant-based source, choline and arginine is not in plant, much less in plant. And for those who regularly do not eat meat, they don't have bacteria that produce TMO.
Right. Okay.
So this is one good point of eat plant regularly. You may not be a vegan or vegetarian, but eat
Right.
mostly plant regularly, so that the bacteria in
Gut
your gut will
bacteria.
be a good ones rather than the bad ones.
Sure. And what is the second possible mechanism
It's
that might be contributing to a higher mortality?
There are a lot of what we call inflammatory cytokines that come with meat product. So many details that, but not exactly correlation to the clinical outcome. Just try to explain. All we know at the moment in terms of scientific evidence, all we know we base on epidemiologic data that people who eat a lot of protein meat, they will end up have shorter lives, higher mortality, more incidence of cancer, and more incidence of, not more incidence, but increase the progression of cardiovascular disease. And of course, they have bone problem because of the acidity of the body, and body mechanism try to buffer by withdraw calcium from the bone. That is well known that meat eater will end up osteoporosis. So all this together, it pinpoint that you eat protein, you should consider mainly the plant sources. Some from animal source, but mainly should come from plant.
Okay. And so maybe a little bit of guidelines to the people listening. Let's say I weigh 75 kilos. I am a male, 33 years old. How many grams of protein would you recommend I should eat every day? Do you think it's something I should even worry about? I want to, let's say I have physical goals to get stronger.
In say 5 years ago, in practice, I am very strict on mathematics, on nutrition. I mean, calculation of calories, proteins. But lately, even in the USDA guideline, they shift their focus from what we call nutrient based focus on protein, carbohydrate, whatever, to what we call food pattern focus. Because if we look at the medical data, difference in mortality actually based on food pattern. Some food pattern like Mediterranean diet, they associate with definitely better health outcomes and lower mortality. And some newly designed food pattern like DASH diet also associate with bringing down the progression of chronic diseases like hypertension, cardiovascular disease, even obesity. And some food pattern like vegetarian associates with less chronic disease and longer length of life. For instance, in US alone, in Loma Linda area where consumption of plant-based food is high, the length of life is 10 years longer comparing with average Americans. So we base at the moment evidence support go with food pattern.
Okay.
Don't pay attention in the detail of nutrients.
So no calorie counting.
No.
Counting
Calorie counting is
proteins
proven long ago
per
that
day.
useless.
Okay, even for weight loss,
Even for weight loss, I mean,
focus on your daily food choices.
because the accuracy of calorie counting is completely unreliable.
Yes, you don't know what exactly your portion size is.
Right.
You don't know. Sometimes even the processed food, the packaging, they say can be off by 20%, 25%. The numbers are not 100% correct.
And talking about the food pattern and weight loss, there was one study, I think in New Zealand, if I can remember its name, the board study. They use the food pattern to reduce weight. And that is the only study that maintain weight loss beyond 1 year. Usually, most of study maintain weight loss for 3 to 6 months. That's all. The board study can maintain beyond 1 year using plant-based diet.
Okay. So, but how would you convince someone who is like always being you know what I mean? How do you tell someone that protein doesn't matter when it, this is the hardest part. Like if you talk about my peers or my own friends and people I know in the fitness industry, if I tell them that, don't worry about protein. If you want to get bigger, eat more calories than you burn. You will put on excess mass. If you want to lose weight, eat less calories than your daily, and you will lose weight. Right? This is we know this for a fact.
Talking to doctors first, let alone layman or general people. Talking to doctor first. The only way to reach conclusion is that we got to make doctors understand the level of scientific evidence and to what we call to assess or to appraise the evidence based on their level of evidence. Even doctors, they do not understand how to interpret the scientific evidence. And the food industry try to make what we call fake evidence, let's say. They buy the journal, they publish data, and they summarize the end of the article. Nothing to do with the content of the article, and then put that summarized into advertisement, something like that.
Right.
These things like that are very about, and even doctors, they do not understand. They do not know how to create the evidence. This is the main problem. I think we got to talk to doctor first.
Right, before you can convince anybody else. But luckily there are a lot of plant-based athletes nowadays that are exist, and I think they, at least it is the first level of proof that you can be like the top athlete in your sport without eating any meat, or even if they eat meat,
that is the epidemiologic data.
They're eating 10% of their diet is meat, or 5%, whatever it is. It's a very small amount.
Kind of real life data.
Real life data, and also, I guess, someone people trust, and someone people look up to as well as like a role model, or
But
someone.
if you agree, I would suggest that your podcast, you are about to start your We Care podcast, you make it a scientific evidence-based podcast. And each talk you summarize the evidence and put it on internet so that people can follow the talk and follow to see the evidence. If you agree with me, I will try to teach the audience.
Yeah. Where do they get this information?
Yeah.
If they want to go to.
And how to what do you call grade the evidence? Because once in my lifetime, I worked with the American Heart Association in selection of scientific evidence to make guidelines. So I am quite familiar with real evidence and fake evidence.
Yeah, if you want something more than anecdotal, just stories, and people are looking to find some scientific studies that are done on these topics, then I think that's also very interesting.
The point is what you call scientific evidence. There are many levels, usually 4 or 5 levels. The lower level sometimes kind of mislead people.
Right.
And the food industry, they work on the lower level. Try to make the mountain out of the molehill down there. So if you agree with me, let's do the podcast that focus on scientific evidence.
On what is the top level of scientific.
How to interpret it. This research, is it really meaningful? Something like that.
Yeah. And maybe just to finish on the protein topic and moving away from building muscle and things like you spoke about for the elderly and the people who suffer from muscle atrophy and things like that, or as you age.
Yeah.
So what do you say about their protein requirements?
Actually, the principle doesn't change much. The main concern is adequate calorie intake, because in elderly there are a lot of factors affect their calorie intake. For instance, the tooth decay or inflammation of their gum, that's reduced their consumption. Depression because of the loss of the loved one, something like that, that also much reduce their calorie intake. Lack of muscle training, lack of exercise. So now it is well agreed that if you see the ACSMMN, American College of Sport Medicine recommendation, exercise for young people, for ordinary adult, they don't focus much on bodybuilding or what we call strength training. But exercise for elderly beyond 65, they focus a lot on
strength
training. So the first point is not enough calorie intake in elderly. The second point is they have no idea that they need to do strength training when they get older. That's very true, important point.
For their bone health and muscle mass and everything, basically to keep that throughout their old.
It is impossible to delay sarcopenia if they don't use their muscle.
Right.
It's impossible.
So again, protein is not the main factor here.
Not at all. Let me give
you calories, and it's making sure that you're getting some form of exercise.
Okay, let me give you some common sense from ordinary people point of view. The time in life that we need most protein is about the first 6 months in life.
Childhood.
The source of protein, only one source is human milk. The amount of protein in human milk is only 0.86%, less than 1%. Very small amount of protein we need to grow the babies. The second common sense, you don't need complicated science to interpret it. You see the cow, the pig, the elephant, the horse, they are all mammals like us. They cannot produce essential amino acid in their body because they are like us. The mechanism of cell production exactly the same like us. They cannot produce essential amino acid inside their body. Where do they get those essential amino acid from? They get from the grass, from plants. So these two common sense, don't worry about the not enough protein, bad source of protein. It's just, let's say, bullshit, basically.
Okay. Sure, yeah. Is there anything else you want to cover on the topic of protein, maybe?
Well,
If people have questions, then please do ask.
They can. Yeah, I'll be happy.
We're also
to,
interested to answer any more questions that other people might have. These are the main ones that I could think of at the top of my head that I commonly find people talking about. But yes, you're right. Most of it is generally linked to the fitness industry and kind of like the assumptions or the beliefs that they have within themselves. But yes, as you mentioned, across all age groups, it's more about your food habits and about making sure you're consuming enough calories.
Okay, I think we have done so well for the first day.
Okay. All right. Well, once again, thank you very much to Dr. Sant for taking his time out today to give us a little bit more information on the topic of protein, which I know is a widely debated topic. And if anyone has any more questions or any more comments, please do leave them below. And we'll definitely be happy to answer them and raise them during some of the next episodes.
Right.
We're also curious to hear your own personal views. So thank you very much for
you're
a
welcome.
very insightful day. And I hope we look forward to seeing you for the next episode
You're
again.
welcome. Thank you. See you.
Thank you, everyone.